So today we're going to finish the last two functions of the urinary system. So yesterday we talked about how your body forms urine through filtration, reabsorption, and secretion, and then it excretes that stuff out of you through your urine that it doesn't want anymore. So today we're going to talk about fluid and electrolyte balance and then the actual act of peeing. So this should be pretty obvious based on that reabsorption and secretion step of urine formation, how the kidneys balance your fluids and your electrolyte levels. So again, fluid, the water part, is mostly figured out during reabsorption. So you kick way too much water out during filtration, and then in reabsorption, you reabsorb back into blood like 99% of it. The electrolytes, some of the electrolytes are done during this reabsorption too, but really secretion, that last step of urine formation, is when electrolytes are selectively kicked out of blood and put into urine. In filtration, remember, nothing about filtration is fine-tuned or fancy. It's literally just shoving stuff out that fits. Reabsorption selectively takes back into blood what it wants, and secretion selectively kicks out of blood what it wants. So in that secretion step, that last step of urine formation, the body figures out what electrolytes, meaning like sodium, potassium, chloride, all that stuff, that it wants to kick out of blood, and so that you'll put it into urine and pee it out. And it does this in order to balance your body's acid-base balance. So your pH of your blood is, meaning how acidic it is or how alkaline it is very, very, very narrow, happy place. So it really has to, all these things have charges with them, and it really has to be careful what it's holding on to and what it's getting rid of to keep the pH of your blood perfect. And in case you don't know what an electrolyte is, it's salts, minerals with an electrical charge. Water follows salt. So like when you kick salt out, water chases it because it's a little fangirl of salt. So it'll follow it. And the same for all these things. So anytime you're kicking out electrolytes, some fluid follows it. All right, so fluid, again, controlled by the reabsorption step, and electrolytes, mostly controlled by that secretion step in urine, are balanced in two ways. Chemical control, and we're going to talk about ADH and aldosterone just a little bit, and then nervous control. Nervous control is super easy. It just means nerves dictate how much blood gets to your kidneys. And so the more blood that gets there, the more you filter. The less blood that gets there, the less you filter. So we're going to spend most of our time today talking about this chemical control. So ADH, oh God, I still have flashbacks from nursing school with ADH and aldosterone. Dear Lord. The A is anti, so it's against it. Diuretic, remember diuretic we talked about when we talked about blood pressure? A diuretic is a medicine or anything that makes you pee more. So I always think diuretic means pee. So if it's anti-diuretic, it's anti-pee. So it's a hormone that your body makes that is anti-pee. It doesn't want you to pee. And so it does that by increasing reabsorption. So you reabsorb back into blood more of the water. So if you reabsorbed it back into blood, less of it is in urine, so you're peeing less. It is anti-pee. Diuretic makes you pee more, so if it's anti-diuretic, it's anti-pee. Anti-diuretic, anti-pee, by reabsorbing more. So remember, water can be in two places in your body for what we're doing right now. It can be blood or it can be pee. And if you reabsorb more into blood, you have less in pee, so you're peeing less. I forgot I put that up there. I was just taking a sip of coffee and that about made me spit my coffee out. I'm so funny. All right, antidiuretic hormone is released. I don't really want you to worry about this. Don't worry about it. Just ADH, anti-pee, hold on to water in your blood, pee less. And honestly, guys, for what we're doing, I just want you to think aldosterone does the same thing. So it also reabsorbs water, but it reabsorbs salt too. And remember that water is salt's fangirl, so it's going to chase it. So it's reabsorbing water, but it's also reabsorbing salt, which is going to make it reabsorb even more water. So it's very, very potent. It's very, very powerful. Little difference, again, with aldosterone is also it secretes potassium. And remember that if your potassium levels in your blood get off, even just a little bit too high or too low, your heart can stop. So aldosterone can be pretty scary because it's so powerful in how much water and salt it's reabsorbing back into blood. but it's also messing with your potassium levels because it's kicking potassium out of your blood, so it can get a little scary. It does this so ADH is activated by salt levels in the blood. Aldosterone is activated by blood pressure levels. So I don't really care that you know about renin and angiotensin and all the stuff that I had to learn in nursing school, but just know that when your blood pressure drops, you end up secreting aldosterone. So when you secrete aldosterone, you reabsorb more water back into blood. So you end up with more blood, which will obviously increase your blood pressure. So you reabsorb more water, which means you have more water in your blood, which means you have more blood. So more blood is more blood pressure. And nervous control, again, just your nerves control how much blood is getting to your kidneys. So if they dilate your blood vessels and make more blood get to your kidneys, you filter more. If they constrict your blood vessels and let less blood get to your kidneys, then you constrict less. This is one of the reasons why when people are bleeding out, they stop making urine, because their body will constrict those blood vessels headed to the kidney because it wants to hold on to all of its blood, all of its fluid. So we're going to think this through. What happens to blood pressure if blood volume increases? If you have more blood, then there is more pressure. Now, what if blood volume decreases? So if you have less blood, you're bleeding out, how much? Well, there's less blood to push on the walls of the arteries, so your blood pressure decreases too. What will happen with an increased ADH and aldosterone? These make you reabsorb back into blood more. So it holds on to fluid in your blood, which means that you will have more blood. So the blood pressure will increase. If ADH and aldosterone decrease, it stops telling your body to reabsorb some of that water back into your blood. It lets you pee it all out. So then your blood pressure is going to decrease because you'll have less blood. So increase ADH and increase aldosterone, increase your blood volume, which increases your blood pressure. Decreased ADH and aldosterone, decrease your blood volume because you're peeing it all out, which will decrease your blood pressure. Quick reminder, diuretics increase how much you pee. I don't care that you know how. Some examples of it are coffee, caffeine, alcohol. That's why when people drink a lot of beer, they end up peeing a lot. That's because beer is a diuretic. The more you pee, the more diluted your pee is, meaning watered down. So what I want you to think of, here is like if you take like a drop of paint and you mix it with a drop of water, that paint's going to be very dark. It's going to be very concentrated, meaning there's a lot of particles compared to how much water it's drowning in. Now let's take that same drop of paint and put it in a gallon of water. Well, now the water is going to be, it's mostly water, so it's going to be very, very light in color. So when you take diuretics, you have the same amount of little salts and things that you're pushing out, but now you're getting rid of tons and tons of fluid, tons and tons of water. And so your urine is something that we call diluted, meaning it's very light in color because it's mostly water. Blood pressure medicines are diuretics. Remember, if your blood pressure is too high, if we can make you pee some of that off because we're blocking reabsorption, it will decrease your blood volume, which decreases your blood pressure. I've had $1 for every time we put a patient on a diuretic medicine to help their blood pressure, and then they call back the next day or a couple of days later and say, "This thing's making me pee." I'm like, "Yeah, buddy, that's the whole point. You're peeing off that extra blood pressure. I don't think this is supposed to happen." Yeah, it is. It's literally how the medicine works. Caffeine and alcohol, like I mentioned, all diuretics. All right, dehydration. We talked about reabsorption is how your body fixes dehydration, because when you're dehydrated, your body will reabsorb. It will suck back into blood more water. So again, every time you say reabsorb back into blood. So when you're dehydrated, your body increases reabsorption so that you reabsorb more water back into your blood. So remember, it can either be blood or it can be pee. So now you have less water in your pee. So you're peeing less water, but the same amount of little salts and stuff. So now your urine is more concentrated. And that means it's going to be dark. Sometimes it can come out so dark that it looks like Coca-Cola. or sometimes it looks like tea. A lot of times it looks like tea. But the darker, usually call it amber color, darker headed towards brown that your urine is, and probably only peeing out a small amount of it, that oliguria, that's because you're still getting rid of the same amount of waste products and crystals, but you're reabsorbing all that water back because your body knows you can't spare it. And so the pee and the crystals in your pee are very concentrated, and so it turns out darker. Now this last function, so we went through excretion and formation of urine yesterday. Now we've talked about your electrolyte balance and your fluid balances, and now we're going to talk about literally just peeing the stuff out. So you empty your bladder. Fancy word for peeing is voiding. By your bladder, which again, remember, is a smooth muscle, it's an involuntary muscle, squeezes. Now it contracts, that squeezes. Now that's when you have to pee. It's when you feel like you need to pee. But what actually lets the urine out are those two sphincters that you have in your urethra. So this one right here, the very first little trapdoor circle muscle sphincter, is still involuntary. It opens when your bladder contracts, and it lets the urine down to here. And this one is the one that when you're about 3-ish, you gain control of. So this is the one that when you choose to relax it, floodgates open. Incontinence is when you do not have control over this. So like all infants and toddlers up until a certain age are considered incontinent because it's involuntary urinating. They pee when they don't mean to pee. A lot of older people lose control over this sphincter again, and they'll have some incontinence, especially women who have had lots and lots of babies. They pee a little when they sneeze and cough because of the pressure. Also, people who are paralyzed. If they're paralyzed at a certain point, you've lost control of the sphincter muscle, and so they don't control it either. Yep, babies, spinal cord injury. Okay, urinary retention. To retain something means to hold on to it, right? If you're retained in your current grade, it means you stay in your current grade, you don't move on. So when people have urinary retention, it means that when they pee, some of this pee doesn't quite leave. It stays in there. It's the inability to completely empty the bladder when they pee. And that puts them at a greater risk for bladder infections because think of it kind of like a little, like a flowing river versus like a mud puddle. The flowing river rinses stuff out all the time. But mud puddles, where there's a little bit of water that stays there, it's a greater risk that every time some bacteria is going to get in there and then it's going to grow and it's not completely going to get out, it's going to stay and just build up. So urinary retention puts you at a higher risk for bladder infections. Again, nerve damage can cause this. Sometimes it's older people will have urinary retention, and sometimes, again, people with like spinal cord injuries. So again, we talked about you pee about 1.5 liters a day. I don't need you to memorize that. Color of urine. So again, if you pee more water, if you're not reabsorbing as much and you're peeing more water, your pee is going to be diluted. It's going to be very light colored. If you're dehydrated and so your body's reabsorbing all of the water but still getting rid of those crystals, then your urine's going to be very concentrated and it's going to be dark. Last slide of the day, a urinalysis. U/A is what we call this, urinalysis. So in the healthcare field, if you've ever had a pee test, a urine test that's not testing for drugs, but testing for like just the content of the urine, this is what it might come back looking like. So it should look clearish to light straw colored, kind of like plasma. pH should be 4.5 to 7.5. So again, slightly acidic usually. Albumin, there should be none because that shouldn't get through infiltration. It shouldn't fit through that semi-permeable glomerulus membrane. It's too big to go through. Remember, people get caught in the fence. They don't wash through. Same with red blood cells and white blood cells. There should be very few to none because none should really be fitting through in the filtration. When you see hematuria, which is red blood cells in the urine or blood in the urine, that's a filtration problem, or it's like, something scraping the inside of your bladder or your ureter like a kidney stone. If it comes from the actual process of making blood, then it's a filtration issue. Sugar, again, there should be none. Ketones, there should be none because your body shouldn't be breaking down too much fat. That's also, if this was positive, it's also a sign of diabetes. That's about it. I think that's good. All right, guys. Good job. Strong work. I think we're done. Oh yeah, blood in the urine. Again, that's hematuria, and it's a filtration problem if it's a kidney issue. Otherwise, it means you have a kidney stone or a bladder infection or something like that. But if it's a problem with the kidney, it's a filtration issue because that shouldn't be fitting through. Only in the diabetes. All right, we're done. So tomorrow we'll start disorders. Bye, guys.